everyone. It's Dr. Owens from O2 Rehab Solutions. And I want to take a moment to update you on what O2 Rehab Solutions is doing to reduce the risk of COVID-19 in our clinic. So, um, one of the things that we do is we have a sign-in process for all our patients. When they walk through the door, they sign their name on a form. And what we've instituted since the onset of COVID-19 is that we require everyone, patient and staff alike, take a temperature. And we use this as a screening tool. And anybody with a temp of 99 or greater, we ask to not attend their session for that day. And if that temperature has other symptoms that sound similar to COVID-19, we make recommendations that they contact their physician and they seek guidance on what they should do. In addition to that, starting Monday, what we are also adding to our process is we have a COVID-19 screen that we have modified from the SNF, which a SNF is more like a nursing home location, to fit the needs of an outpatient clinic. And so with this, it's basically asking questions like, have you washed your hands? Do you have particular symptoms of COVID-19 that you can identify, by reading the screen, and then you mark the screen appropriately. So, have you traveled in the last 14 days internationally? Do you work or have you been around somebody that has had a positive case of COVID-19? On and on. And so we're using this screen to determine if it's really appropriate for you to be at the clinic at that time. The staff, we are wearing PPE. So don't be alarmed. Feel confident that we are doing all the things that we can do to prevent the spread of COVID-19. And I didn't mention this, but this is part of the process when you first walk in. I did talk about in the screen, it asked, did you wash your hands? But all clients are required to wash their hands before starting their intervention with us. And then once they've started, we have cleaners that we have distributed around the clinic. We have hand sanitizer. We have gloves that are accessible as needed for individuals. And we ask that you are just as much a part of the process as us. When you finish with the bike, you're wiping that bike down. When you finish with the treadmill, you're wiping that treadmill down. And we are also monitoring and we are assisting with that process. If we see that it didn't get quite wiped down as well as we would like to have seen it, then we take over and we do that. Or if we see that somebody has forgotten, we gladly step in and we do that. And we are wiping down mat tables between each individual use, which is a practice that we always use anyway, but definitely diligently using in the current state of affairs. So in addition to that, we know that our caseload varies as far as the health of the individual. And we have some very young clients that come, and then we have some older clients, more mature adults that are also attending our clinic. And, often what happens is, it doesn't really matter. Some people have more comorbidities than others. So if you're wondering what a comorbidity is, it's just kind of those health diagnoses that we may have. Some key ones when it comes to COVID-19 would be hypertension, chronic respiratory issues such as asthma, COPD. These are things, heart disease, these are things that, we would be watching and monitoring those individuals more closely. So say you fall into that category, and even with the steps that we're taking in the area of prevention, you still are uncomfortable. For the first time in history, physical therapy is included in the telehealth world, which means that we are now able to come to you via technology to provide you with physical therapy services in your home. And that can either be by telephone, and there are conference opportunities now, video conferencing opportunities that are available now as well. The tricky part is that it's not, just across the board with these insurance companies. They don't all have the same policies. They aren't all allowing us to do this. And so what we are willing to do, like always, is we're willing to call your insurance if we don't know already their stance, and figure out, is telehealth an option for you, and in what capacity? What are the qualifications? For example, if they have a time allotment that they will cover, can you do the eval? Can you not do the eval? Like, we will find out all those details for your specific case and share those with you. So I'm not going to take a lot of your time this evening, but I think it is important. And I think if I were in the shoes of the patient, these are questions that I would have. What is your company doing? How are you working to keep us all safe? O2 Rehab Solutions would like to extend our prayers and our well wishes to everyone out there that knows somebody, has a family member, a friend that is battling COVID-19. We are with you. We support you, and we hope the best. Please take a moment to like this video. And if you aren't following our business page, search us at O2 Rehab Solutions and follow us. We also will be placing videos on YouTube. And if you are interested in seeing what O2 Rehab Solutions will be putting out, please take a moment to subscribe and hit notifications so you can get the videos as soon as we're uploading them. And finally, follow us on Instagram, O2_rehab_solutions_LLC. Thank you, and we look forward to interacting with you again soon.